In July 2016, the Medical College of Wisconsin matriculated its first class of medical students at the Central Wisconsin campus located in Wausau, Wisconsin. The Central Wisconsin campus aims to address the healthcare provider shortage in the area by training community-focused physicians that will serve the healthcare needs of Central Wisconsin. Within the greater Wausau area, rural and Hmong populations are greatly underserved in medicine. Building a strong doctor-patient relationship is crucial to providing excellent healthcare. Having physicians that look like the patients, understand the patient's culture, and adequately represent the people that make up the local community help facilitate a much stronger, trustworthy doctor-patient relationship that is needed to build a healthier community. However, literature suggests that just placing a medical school in a more rural area near a specific population is not sufficient in helping students underrepresented in medicine successfully navigate the medical school admissions process. MCW-Central Wisconsin wanted to develop a more targeted effort to make this regional campus more accessible to Hmong and rural students. With the support and partnership of multiple local educators, health systems, and organizations, the Advocates in Medicine Pathway, or AMP, was established. AMP is a program aimed to support the professional development of undergraduates from Wisconsin interested in attending medical school at the MCW-Central Wisconsin campus. The program is built to help address the barriers that underrepresented students in medicine encounter when applying and transitioning to medical school. I felt drawn to participate in this project after reflecting on my own experiences applying to medical school. I had very little guidance navigating the application process as I did not have family, friends, or connections to the medical field. Applying to medical school is very challenging if you are not connected to the right people and resources. AMP is a program that aims to support students by providing them with the knowledge, resources, and community connections needed to successfully apply to medical school. As an individual that had recently gone through the application process myself, I hoped I could serve as a mentor to AMP students and provide the tools and knowledge needed to successfully apply. In the spring of 2021, the AMP program had its first cohort of 10 students successfully complete the program. These students were surveyed throughout the program to determine areas of programmatic improvement, and they will be followed over time to see if they are able to gain admission to medical school following their participation in AMP. We are excited to have our second AMP cohort starting in the spring of 2022. One of my greatest takeaways working with AMP came from a student quote collected in our program evaluation. Back in freshman year of college, there wasn't a program like AMP, and as a Hmong student, it was very hard. I didn't have role models to follow or have a good group to keep me on track of what I was supposed to do. In all my groups, we claimed to be pre-med, but as the years went by, I started to see less and less of my peers on the pre-med track. I was basically lost, and it was hard to navigate the pre-med route. AMP has really helped me connect with professionals, and I think that's going to be of great help in my future. I think this quote embodies the goals and mission of the AMP program and shows there is a true need for programs like AMP for students that are underrepresented in medicine. By participating in this project, I have learned firsthand the importance of understanding the unique needs of the community and understanding the barriers people face trying to meet those needs. In my future career, I will work with many members of the community that will face barriers that will impact their health. As a community-focused physician, my role will not only be to address the health issues that walk into my office, but to be aware and actively engage in addressing barriers within the community that impact the community's overall health.